Good evening and welcome to Montgomery Heart Wellness. And tonight I'm going to take a different uh, approach to my discussion. Usually I cover an event of someone, an athlete or a major sports figure or entertainer, et cetera, who suffered a medical event. We've been doing a lot of that lately, and we talk about that. But many of you may be aware of the discussion or back and forth on Twitter between Joe Rogan and Dr. Peter Hotez. Dr. Peter Hotez is a pediatrician, professor of pediatrics here in Houston at Baylor College of Medicine, actually 4 miles north of our center. And there's an interview that he had with Dr. Hotez, and they got into the discussion of nutrition, a healthy diet. And I want to play that for you, and I want to dissect that segment because many people are talking about the proposed debate between Dr. Hotez and RFK Jr. about vaccines, et cetera. I don't want to deal with that tonight. I want to talk to you about Dr. Hotez's approach, or at least his apparent thoughts about a healthy diet. So before we get into that, let me just, for those of you who may not know Dr. Hotez, let me share with you something about Dr. Hotez. So who is Dr. Hotez? He's born in 1958. He's an American scientist, a pediatrician. Oops, so let me share my screen with you. He's a pediatrician, is an advocate in the fields of global health, vaccinology, and neglected tropical diseases. He serves as the dean of the National School of Tropical Medicine and professor of pediatrics and molecular virology and microbiology at Baylor College of Medicine. I attended Baylor College of Medicine for my internship and residency. He's also director of Texas Children's Hospital Center for Vaccine Development and Texas Children's Endowed Chair in Tropical Pediatrics. So he's an endowed chair professor and University Professor of Biology at Baylor College of Medicine. Dr. Hotez served previously as president of the American Society of Tropical Medicine and Hygiene and is a founding editor-in-chief of PLOS Neglected Tropical Diseases Journal. He is also co-director of Parasites Without Borders, a global nonprofit organization with a focus on those suffering from parasitic diseases in tropical environments. So Dr. Hotez, needless to say, is a well-celebrated, well-credentialed physician, physician of pediatrics, a professor, a endowed chair professor. So he's reached the pinnacle and many would say the pinnacle of status in academic medicine. But what I want to do is share with you an interview you had with Joe Rogan. And when Joe Rogan is talking to him about vaccines, apparently, and then Joe Rogan comes in and says, well, do you do any other things to boost your immune system? And here's the response. So let's go into that interview.
Do you take care of your immune system in other ways? Do you take probiotics? Are you cautious about your diet?
I'm not as cautious about my diet as I should be. I'm a junk foodaholic.
So I'm going to break this up. So right there on the offset, so he has a little grin on his face, and Joe Rogan, if you've not seen his interviews, he can be a little sneaky because he's got a motive in terms of this next line of questions. So he said, well, do you take care of your immune system in other ways? Do you take probiotics? Do you watch your diet or follow a healthy diet? And essentially, immediately, Dr. Hotez says, I don't, follow a healthy diet or watch my diet as much. I'm a junk foodaholic. So immediately he comes out and says, I'm addicted to junk food. But let's look at the follow-up on this.
Actually.
Well, that seems like a terrible thing for your health.
It is a terrible thing for my health and something my wife is working on.
But that's
So again, he admits it's a terrible thing for his health. And then he says it's something his wife is working on. So apparently he's not taking responsibility for his own health. So he's a junk foodaholic. He knows it. It's something he sort of smiles about. But let's look further.
Someone who works with health.
Yeah.
What's going on with you, man?
Sometimes, man, I just don't get it right.
So again, Joe Rogan, I mean, to some extent, in a subtle way, directly attacks him. This doesn't sound right, ridiculous for someone who works in health. So here it is: you are a healthcare professional. You're at the pinnacle of the status of physician, certainly in academic medicine. And the most simple thing in terms of what to eat, you either don't know what's beneficial to eat, or you don't care enough to practice this on your own. But then the thing that really gets me is how he laughs about it. It's something that seems to be very nonchalant and very minor. Let's listen.
What?
How often?
How often do I steal a bag of chips or something
How often
like
do
that?
you eat garbage?
I don't know.
So how often? So Joe's now he's digging in deeper. So now he's saying how often? And he said, well, how often I eat a bag of chips? No, how often do you eat garbage? And then Dr. Hotez doesn't give any pushback on the fact that he's describing what he eats as garbage. He then tries to come up with some answer to this, and let's listen.
Hopefully not every day, but
Hopefully not every day.
Maybe a couple of times a week.
He's not even sure. Hopefully it's not every day, maybe a couple of times a week. So one, he calls himself a junkaholic. He doesn't know how much he eats garbage. He hopes it's not every day, but he thinks it's a couple of times a week. Now, if any of you have ever dealt with people who have a substance abuse, alcohol, cigarettes, whatever, and they say, well, how often do you drink? Well, I drink maybe a couple of times a week. You probably have to put that to the power of 10. The point is that they often underestimate how much they drink or underestimate how much they smoke, or in this case, he's probably underestimating how much he's eating junk food. But I'm not trying to be critical from the standpoint of, he's admitting the fact that he likes junk food, but there's a cavalier disposition about it. It's like, okay, this is funny. And let's just see how he deals with this further as they get into the interview.
That's what with Rachel, my daughter with autism. That's like our thing is to go to the it's called the burger joint or to Shake Shack to get a cheeseburger. We'll sneak some fries. So.
So again, he goes into more detail. He goes to the burger shop. He sneaks some fries. He's going to describe it in the next segment as living large, but he's smiling the whole time. It's nothing. He's saying, well, look, yes, I have this issue with eating junk food. I'm working on it. These are the things I'm doing. I'm working on detox. I'm reading books. No, it's not. I mean, this is just all kind of a funny little casual thing. And I'm going to share with you the problem with this after we've kind of gone through the interview.
Living large, we call it.
Like that mouth pleasure so much, you're willing to sacrifice a little bit of
I
health.
am, yeah. I have to concede that's the case.
Now, notice how he rubs his nose, a little bit of guilty appearance. I'm not a body language reader, but there's something significant rubbing that nose the way he did. But maybe we'll get a body language reader one of these days. But the point is that he's minimizing this. He's laughing about it. This seems like something that's very trivial and cavalier. Now, I suspect he was caught by surprise during this interview, but this is a very unfortunate take here. So let's listen further because Joe Rogan gets a little bit deeper into this whole discussion of healthy eating and the like as it relates to your immune system and other health issues.
There's, I don't have to tell you, but there's a large body of data that connects poor diet to a host of diseases.
Mm-hmm.
Now, again, Joe said, I don't have to tell you, but there's a large body of data. So here he's lecturing the professor on the importance of healthy diet and, adverse effects of an unhealthy diet on chronic disease and the importance of a healthy diet in reversing or preventing chronic disease. And so he's bringing this up. And so let's see how the professor responds.
It seems like a crazy decision for a guy in your line of work.
There you go. Sometimes it's not all brain. It's something else.
Now he's clearly caught here. Rogan says a crazy decision for a person in your line of work. And so there he's lying, he's laughing about it, and again, very cavalier. Let me just sort of go through the rest of the interview without interruption, And I'm going to share my thoughts in full toward the end.
If you ate healthy food, I mean, the thing is your body starts craving healthy food. You start feeling
no
positive
question.
results.
No question about it.
Do you take vitamins?
I don't take vitamins.
Really?
Yeah. I don't
Wow.
think they do. I don't think they're needed because most in
What?
the American.
Hold up. You don't think they're needed while you're eating junk food?
Well, hopefully I'm not only eating junk food.
Okay,
right?
but there's a large body of clinical research on the efficacy of vitamins, especially vitamins D, vitamins B.
I have taken vitamin D for periods, on the recommendation of my internist. Yeah.
What about essential fatty acids, which are great for your brain, fish oil, all these different things that are fantastic for your
I'm not going to argue with you.
What is going on with you, doctor?
You got it. You got it over me. Yeah.
Listen, but you would have a much better argument, don't you think?
You're making my wife's day here.
If you're taking care of yourself 100% instead of
but you still need your vaccine.
Now, sorry, I said I'm going to interrupt. Notice there, he's on the ropes. He's eating junk food. He has no defense. Then he says, "Oh, I don't take vitamins. They're not needed." Then Joe Rogan comes in and say, "Wait a minute. You mean you're eating junk food? You say you don't need vitamins?" And he has to backpedal there. So he comes out and says vitamins are not needed. Then he's supposed to backpedal. And then he says, "Oh, well, yeah, I do take vitamin D occasionally at the recommendation of my internist." And so now he's backpedaling. But then what does he come to? "Oh, you still need your vaccines." Well, wait a minute. We're talking about healthy diet, supplements, and other ways of boosting your immune system. Apparently, he doesn't promote these. At least he doesn't practice it. And now he's saying, well, oh, my goodness, you still need your vaccines. Let's look further.
I'm sure you do, but vaccines aren't going to prevent cancer.
No, that's true.
Right.
That's
and
true.
There's a lot of diseases.
Or diabetes or cardiovascular disease. Or
and a lot of these diseases are connected directly to diet.
Right.
Yeah.
Yeah.
Come on, man.
And other lifestyle changes.
Yeah. Good to get your exercise. You run?
Yeah.
Do you?
Not very well, but
no. But you do. Okay.
Yeah.
We got to get you healthy, buddy.
Yeah.
Can't be pushing only chemicals in injectable forms to facilitate health.
Fair enough.
Yeah.
Not chemicals, they're vaccines.
Oh, I'm sorry. What's in them?
What?
It's not. I mean, it's some sort of chemical. No.
No, they're antigens, right?
What's the fluid?
Macromolecules.
What's the liquid stuff?
Typically, it would be saline or salt water. And...
Right.
So anyway, again, I'm not trying to pick on Professor Hotez. I mean, he's well accomplished, and I'm sure he's great at what he does. But the point I'm making is the following, and it's not just Dr. Hotez. It's the entire medical community, because we have lots of accomplished physicians in the fields of, you name it, cardiology, endocrinology, pediatric virology, et cetera, et cetera. And the underlying thread is that, there's a total disconnect between the benefits of a healthy lifestyle and an individual's health by all of these specialists, by all these experts. And so here's someone who's at the pinnacle. Here's during the pandemic, there's a big promotion of get the vaccine, but no one talked about optimal nutrition, exercise, fresh air, sunshine. There's lots of data in terms of how healthy diet, plant-based diet for that matter, decrease the severity of infection, how vitamin D boosting the immune system was beneficial. There's lots of information in terms of many things that you can do to improve your body's innate immune system. It has nothing to do with what your stance on the vaccine is. I'm not going to deal with that tonight. But regardless of whether you're saying take the vaccine or you're not saying take the vaccine, you should be saying you should improve your health. You should be, and in our patient population, we were able to take patients, put them on nutritional detox diets and the like, and help them improve their immune system to the point that if they caught the COVID infection, they did fine. But also it helps improve their overall health and well-being. It can help them reverse their diabetes and heart disease and other chronic illnesses. So it's an unfortunate thing. And the reason I highlighted this interview is that this interview highlights and underscores the entire thought process of the medical community. Dr. Hotez was not just necessarily speaking for Dr. Hotez. You can argue and make a strong argument that his feelings and thoughts and ideas toward a healthy diet was very similar to that of the vast majority of physicians practicing medicine in the United States. And that's a tragedy. And the cost of our healthcare goes up, sickness goes up, our life expectancy is going down. And one of the major reasons is that our healthcare professionals, those whom we look to, and I should say us, I'm part of that group. I try to do better, but I'm part of that group. The healthcare professionals are not equipping their patients with the proper information in terms of optimal health. And it starts with a healthy diet. It starts with fresh air, sunshine, exercise. Those things should be the foundation of health. Before you have any discussion about what drug or surgery or shot you need to take, you need to have a thorough and lengthy discussion with your patients about, and we should have the thorough, lengthy discussion with our patients about what their diets and lifestyles should be. So I wanted to really emphasize this because there's a lot of discussion online about Dr. Hotez debating RFK Jr. Well, I would like to issue another challenge to Dr. Hotez. Montgomery Heart Wellness and the Garden Kitchen is just 4 miles south of the Texas Medical Center. And the Baylor College of Medicine is the Texas Medical Center. I want to invite you to come to the Garden Kitchen. I'll offer you a free GK28 detox meal plan, and that will help you get rid of your junk foodaholic, addiction to junk food. And I say this in all manners of respect as a colleague, and I think it's something that we need to stand together. You and I and other professionals in the community need to stand together and promote healthy living, starting with a healthy diet. So you can go to montgomeryheart.com, go to our Facebook page, direct message me, or you can just call the office at 713-599-1144, and we can talk to you about getting onto one of our GK28 20-day detox meal plan where we prepare all the food for you. We'd like to capture it on video. We can stand together and promote optimal nutrition to the general public. You have a great platform. You're well known. I think this is the time to go and turn over a new leaf and start to add healthy diet to all of your other, I'm sure, fantastic recommendations to your patients and your colleagues. So anyway, let me know what you think. Please put your comments in the chat. Also, I didn't say it earlier, but give us a thumbs up. Help us with the YouTube algorithm. And if you're new to the channel, subscribe, and of course, share this information. I think this is very important information that we should all take heed to. Until next time, take care of yourself. Look forward to seeing you on the next video.